That is an interesting and broad question, and it is one that employers, particularly SMEs, will struggle with because they understand the imperative to invest in workplace well-being. I mean, there's a whole plethora of reports, McKinsey and Deloitte and Business in the Community published fantastic research saying this is the economic value and the return on that investment, but it's that investment that is the problem for many when they're trying to balance the books at incredibly challenging times in terms of cash flow and available resources. So that would be the first message really from me to employers is to really get under the skin of what it is you need, because there's lots and lots of people and organizations out there who quite happily take your money from you to deliver things that you may never actually use or need. And that starts with doing some groundwork first in your own organization. And there are plenty of tools and things online that help you do an audit, and whether that's a stress audit or whether there are specific drivers you're already aware of, the chances are you've already got data in your organization that will help you make that evidence-based approach. So just think about that first. Think about what data you have to support the case for investment, and where it needs to be allocated. We've seen so many initiatives. Every month there seems to be a new, it's Men's Health Month, or awareness of one kind or another. The danger can quite often be, and from the best place this comes from quite often, it's with good intention that organizations will go out and invest heavily in the next big thing without really thinking about how it's going to be operationalized and what the benefits are going to be for the organization. And it starts with conversations. It starts with conversations with your workforce about what they would like and what they would need, and to make those conversations as open and transparent as possible, such that you're reducing the likelihood of employees sort of shutting down. Because quite often, if an organization turns around to their workforce and said, "What are you struggling with?" people don't often want to talk about it. They'll see it as a career limited move, or they don't want to look, particularly in a climate where you might already be feeling under threat potentially. That the organization might be struggling. Many people will be coming to work and perhaps hiding the extent of the problems they're facing. So it's about creating an environment, a space in which people can feel comfortable, and that's where having a sort of a neutral, if you like, an external organization come in and work with you on that, and work with employees, can really help as that buffer. And that's one of the value, I suppose, of investing in workplace counselling, psychotherapy or therapeutic coaching. And what I'd say is that if you're going to go down that route, if all of your work and the sort of the groundwork you've done thinks locally, these are the things that we need in place, whether that's provided through an EAP or whether it's provided through private practitioners who come in and deliver specific bespoke services for a small number of workforces. It has to be what works for you. And if you're an organization who has little understanding or experience of commissioning those kinds of services, reach out to someone like the BACP. We have lots of accredited services on our directory, and accredited services are ones that have met the highest professional and ethical standards in terms of delivering workplace counselling. We have a workplace counselling competencies framework that therapists working in organizations can work to ensure, again, that their practice meets the highest ethical and practice standards. So there is that guidance available there. But of course, the landscape, again, it's vast. If you put a Google search in workplace well-being and counselling, you're going to see a heck of a lot of things. You're going to see, digital online solutions, and it's very difficult to sort of know where to turn. And we can help with that. We can bring that expertise to bear. And when you're working with therapists, it's always important to to make sure that they're accredited or registered with, a PSA accredited, that's the Professional Standards Authority accredited register. And that gives you, again, that sort of that assurance that you're going to be working with somebody who's, safe, practicing ethically and competently, and not acting beyond their competence. And just think about what it is you're investing in, why that investment's necessary, and what return you expect to see that. What will success look like for you? Is it about reduced absenteeism? Is it about increased productivity? Or is there more to it than that? Are you going to find that your workforce is happier, that they are suddenly more creative, perhaps, as a result of having that space and time to talk with somebody about how they're feeling about their work. So I think that's an important thing as well. And people get hung up sometimes, I think, on the data and on the measurements, and try and think about how they can, manage and measure the minutiae detail. But fundamentally, it's about ensuring that people feel more comfortable and happy and committed to their work. And again, there are a range of things that you can do. There's lots of things online that can help you with that without having to outlay a huge amount of money. Of course, the other option is to go with, an EAP service. There are many, many types of them out there. Again, we have lots on our accredited services directory, but also lots of organizational members as well that are delivering services to a range of public, private, and third sector organizations. And they'll all have, particular strengths. So it might be, for example, that you're looking for therapists or a service that understands your sector. It might be, for example, you're in the farming sector or retail or the rail sector, and the chances are you will find an organization or therapists that have specific expertise in that area. For example, if you're looking for trauma-informed therapists, again, you can search for those on our database, on our therapist directory, or our accredited services or organizational members as well. And to give that, again, that sort of quality assurance. But yeah, I would say that. Another thing is really key, I think, is to make sure that whatever you're investing in is backed up in some way, articulated within a strategy. A clear strategy where you've laid out what it is the organization needs, why you're investing in this, and what, again, you're expecting to see in terms of a measurement and an action plan, as well, just to ensure that you're all, pulling towards those goals, and whether or not you're having an impact. Quite often I've seen organizations that will go out, and I've spoken to large, multinational, blue chip, global organizations. I've worked with, SMEs with literally a handful of employees. And, quite a lot of them have said to me, well, we've invested X amount, some millions in this particular initiative, and we're not really sure what we're getting back for it. And now, whether your turnovers in the millions or whether it's, in the thousands, it's really important, particularly in this climate, to make those, investment decisions wisely, or as wisely as you possibly can. Again, to ensure that you're getting value for money, but also that that your employees feel as though you're doing the right thing. Because if you're not, of course, they'll soon tell you, or they'll show it.